Now that we've talked about the physiology of the nervous system, let's talk a little bit more about the different parts of the nervous system. The central nervous system is the part that we're seeing in pink right here in the image. So this is going to include the brain and then also the spinal cord. The brain is going to be really the largest, most complex mass of nervous tissue that we do have in the body. And you can see down here at the bottom of this slide what we're talking about with the brain. You can see a brain from a 13-week-old fetus, and then we can also see the adult brain there. And this brain itself is going to contain really 4 major regions to it. So if we briefly look at those 4 major regions, you can see them shaded in different colors in this image here. We call these lobes. We have what's called the frontal lobe, we have the parietal lobe, the occipital lobe, and then we also have the temporal lobe. And with these different lobes, if we just take a little cross section from this, we have different structural features that we can see when we look at the brain. Some of those are what we call gyrus. These are elevated ridges of tissue, so that's why the brain kind of looks lumpy when we look at it here. If we look at more details to the brain, and we don't want to go through and talk about what every single one of these structures is going to do, I'll just point out a few of them. We do have the primary somatic sensory area. This is going to be responsible for interpreting impulses that come in. So this is going to be interpreting impulses that travel from the body's sensory receptors. So they're bringing information to the primary somatic sensory area. Another part to point out is the primary motor area. The primary motor area is going to allow conscious movement of the skeletal muscles. So when the information comes in, this is what we're going to use to actually control that output that we get. Another area to point out is Broca's area. This is going to be the area that controls motor speech. Now, all of these areas that we've mentioned, the functions are located or found in the gray matter area of the cerebral cortex. If we look at another sectioning of the brain, in this image here, we can see a lot of the fibers that are involved in connecting together the different parts of the brain. We have the commissural fibers. These are responsible for connecting the cerebral hemispheres. And then another one is that we have what are called basal nuclei or basal ganglia. These are going to be islands of gray matter, and these are going to help regulate motor function. This view of the brain is going to show us the diencephalon. This is composed of the thalamus, the hypothalamus, and then also the epithalamus. And so those are actually just kind of highlighted for you here. So different regions of the brain. These are involved in controlling body temperature, also emotion, and then also metabolism of our body. In this view of the brain, we're seeing the skull, so the bone that's there, which has a big protective role in protecting the brain. And then we can also see the underlying brain. Separating the brain from the skull, we have meninges. These meninges are composed of connective tissue membranes, so they're going to help to provide some cushioning there. And these are going to be divided into what we call the dura mater, the arachnoid mater, and then also the pia mater. The cerebral spinal fluid, which we call the CSF, this is going to be formed continuously from blood. And what this is going to do is it's going to provide a water cushion. So it's going to help protect the brain, protect that very fragile nervous system, and it's going to protect it from blows, other trauma that might happen. And this cerebral spinal fluid is meant to be continuously circulated around the brain. So here we can see in blue here really where that cerebrospinal fluid would be flowing. So we can see that it is flowing all around the brain. Here's just another look at it so we can see where it is actually flowing through and kind of the path of the circulation. So the first thing that happens is that it is going to be produced from the blood, and that is going to be a continuous production of cerebrospinal fluid. Once that is produced, it's going to flow through the ventricles, and then it's going to basically circulate around and flow all throughout. And later at the end, it's going to be absorbed into the dural venous sinuses. And so it's absorbed in, and we just continuously produce and continuously circulate it around the brain itself. Again, for the purpose really of protecting those delicate tissues. The brain is especially dependent on a constant internal environment. So it's really important that we maintain homeostasis, if we use that word homeostasis here, and keep that constant internal environment. We do have what's called the blood-brain barrier. And that blood-brain barrier is going to keep the neurons separated from blood-borne substances. So protecting the neurons from blood-borne substances. It has the least permeable capillaries in the whole body, and it's not going to be effective against fat-soluble substances. So fat-soluble substances are going to be able to permeate there, but other substances, things that are not fat-soluble, they would not be able to permeate. So if we're talking about something that would be hydrophilic or water-soluble, it can't permeate. If we talk about brain dysfunctions, there's a lot of different brain dysfunctions that can occur. One of them is traumatic brain injuries. Traumatic brain injuries are caused by injury at the site of the blow. So this is a physical trauma that happens. This injury is not only due a lot of times to actually physical blows, but also to this ricocheting or kind of bouncing around of the brain inside the skull when you do have that physical trauma that takes place. Types of these, concussion is a very common one. With a concussion, this is a slight brain injury. So we hear about this a lot when we're talking about sports like football, where there is a lot of head impact. Even though you do have the helmets there, you can just think about the fact that you can have some bouncing around or jarring of the brain when we do have those big impacts. They're slight brain injuries. Typically, we get little permanent damage when we're talking about a concussion. A contusion itself is going to be marked by tissue destruction. So a contusion is more serious for sure. This may lead to a coma. And when we're talking about a coma that's due to a contusion, this could be a short coma, so just a few hours, or it could really be very significant. It could be for a lifetime, the coma that we're talking about. We can also have what are called intracranial hemorrhages. Intracranial hemorrhages are when we actually have bleeding that's taking place. This is going to be bleeding because of ruptured vessels that happened when we did have that physical trauma, and this can result in death when we have bleeding or hemorrhage in the brain. A cerebral edema, this is going to be swelling of the brain. This is a swelling that's due to an inflammatory response to injury. This can also result in death, so that is certainly possible. A cerebrovascular accident is another word for a stroke. This is certainly a brain dysfunction that can happen. It's a fairly common one, unfortunately. This is the third leading cause of death in the United States. What a stroke really is that this is going to be a blockage of blood circulation to some area of the brain. And when we're talking about these blockages, this can be something that is transient, it's temporary, and the patient survives. It could also be something that does result in death. You can see in the image here the blockage that we're talking about. So blockage in the blood circulation. So some areas of the brain are not getting the blood flow that they ought to have. And if we're talking about transient ones, so temporary ones, these are called transient ischemic attacks. And this is a temporary restriction of blood flow. So some strokes will be a temporary restriction of blood flow, and there can be permanent damage when we're talking about strokes. So the sooner we get attention to those, the better the recovery from those, because we will be limiting the amount of time that the blood is going to be blocked to a particular region of the brain. Another brain dysfunction, one that we do hear a lot about, is Alzheimer's disease. Alzheimer's disease is a progressive degenerative disease of the brain. What we mean by progressive is that it gets worse over time, and ultimately this is going to result in mental deterioration. What we mean by mental deterioration is that this is going to result in dementia, so confusion. You can see in the cross sections here the comparison between a healthy brain and then severe Alzheimer's. And you can see that it's a progressive degeneration or wasting away of the brain itself, again, ultimately resulting in dementia. If we look at the other component of the central nervous system, the spinal cord is that long pink part that we see going down through the image. This is a continuation of the brain stem. And so this is just really connecting and continuing the brain down the body. It's approximately 17 inches long when we're talking about the spine. The spinal cord is going to be cushioned and protected, very important because it is very sensitive, fragile tissue. It is protected by meninges. When we're looking at the spinal cord, there are basically 31 pairs of spinal nerves, and so these spinal nerves are arising from the cord, and then they're going to exit the vertebral column. If we take a closer look at the spinal cord, we can see that this is composed of white matter and gray matter, and we have different nerves coming in, or ganglions coming in and out. The dorsal root ganglion is the one that is really responsible for sensation. So this is carrying information to the central nervous system. Damage in that one is going to result in a loss of sensation, so a loss of feeling when we're talking about damage to the dorsal root ganglion, because again, this is carrying information in, and now it would not be able to carry that information in. The ventral root of the spinal cord, this is responsible for carrying information out. So this one is going to cause paralysis, which is an inability to move your organs when we do have damage to the ventral root. The gray matter that is surrounding the central canal, so you can see that central canal there, that gray matter is surrounding the central canal, which is going to contain the cerebral spinal fluid. So we have cerebral spinal fluid flowing down the center of the spinal cord, and that is surrounded by gray matter. Here's just another look at how it's kind of all tied together. We've got the brain. The brain is going to be sending information down to the spinal cord, and then from the spinal cord, we will have the spinal nerves, which are exiting and carrying the information to different regions of the body. That information is going to control the output, the response that we actually get. If we look at the peripheral nervous system, the peripheral nervous system is shown in blue in this image. This is composed of nerves and scattered groups of neuronal cell bodies, which is also what we call ganglia. And just looking at this in closer detail, a nerve is a bundle of neuron fibers, and it's a bundle of neuron fibers that are specifically outside of the central nervous system. So you can see that it's a lot of nerves, neurons actually bundled together. So notice here that when we're looking at this, you've got so many of them bundled together. They are held together with what's called a fascicle. And then we have several of those which are held together in a tighter arrangement to give us the whole nerve structure. And there's going to be some blood vessels that are running through the center of that also. We have protective coverings of these different neurons. Again, these protective, really important that we protect the delicate tissues. When we get down to looking at the actual nerves, there are 12 pairs of cranial nerves. If we look at the spinal nerves and the nerve plexuses, there are 31 pairs of spinal nerves. These spinal nerves, they're named based on the region from which they arise, so where they actually come out of the spine. And this is the general structure that we have to them. So you can see the spinal cord, just a section of it really small right here. These nerves are exiting. They have dorsal parts, and then they also have the ventral parts. Again, the dorsal part is supposed to be carrying the information in to the central nervous system, and then the ventral is going to be carrying the information out. Here's just a look at where those different spinal nerves and nerve plexuses are located at. And they have different names based on where they're actually coming out of. Here's a closer look at what they would actually be controlling. So different ones are controlling different limbs. We have some that are controlling the upper limbs. We have some that are controlling the sacral plexus, so the posterior of the leg. We have the lumbar plexus. We have the anterior view. If we look at the autonomic nervous system. The autonomic nervous system, it is part of the peripheral nervous system. This one is responsible for controlling those automatic body activities. So in other words, the involuntary body activities. This is responsible for regulating cardiac muscle, smooth muscle, and then also glands. The somatic nervous system is what we've talked about already, and with the somatic nervous system, you have these really long neurons, so they have those long processes, and it's not going to be as many parts really when we're talking about the somatic nervous system. When we get into the autonomic nervous system, notice that we have more pieces involved in it. So more pieces involved in the overall control of that automatic response. If we look at this a little bit closer, the autonomic nervous system, we have portions that allow the unwinding and conservation of energy. This is what we call the parasympathetic portion of the autonomic nervous system. And then we also have what we call the sympathetic portion. This is going to be mobilized during extreme situations. So if we are responding to some extreme situation, these are going to just automatically respond to that. We don't have to think about and make that response happen. Our body's going to automatically do it for us. If we talk about the development of the nervous system, this is something that begins very, very early during the development of a new individual. So by very early, this is already developing during the very first month of pregnancy. The development of the nervous system is very sensitive to our environment. So it can be affected by a lack of oxygen, smoking, drugs, radiation. All of these things are impacting, and that is one reason why it is very important for an individual that is expecting to take very good care of themselves, because there is this potential impact on nervous system development. There are a number of developmental disorders that can happen when things do not go correctly. And here's just a short list of them. Some examples of errors during the development process are cerebral palsy, anencephaly, which is failure of the cerebrum to develop. And then we also have what we call spina bifida, which is an incomplete forming of the vertebrae.